Man, know whether the lecture is on.
Jigbe, we are waiting for the lecturer. She will join us soon.
Thank you, Desmond.
All right.
No, what I'm doing is different from. I know, but I just want to make that. What is that? That place that is locked. Hello, good afternoon.
Afternoon, man.
Good afternoon.
Good afternoon, ma.
We're back again.
Yes.
Yeah. So, how was your lunchtime?
It was okay.
Lunch time has finished, too. Thank
Lunchtime has finished.
you. Yes, ma, it has finished, too. We are back to class. Thank you.
Yeah,
And
that's
that was
good.
why she asked how was lunchtime.
So why is it? Have fun. Mama no dey. Where she go?
Just a minute, please. Just a minute.
All right, man.
So, Okay, so we were talking about psychopathology as statistical deviance. Are we together?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. And we're saying that a commonly used and common sense conception of psychopathology is that pathological psychological phenomena that are abnormal, that are said to be abnormal if they are statistically deviant or infrequent. Now, that is to say, some normal behaviors are already made known through statistics that this kind of behavior is a normal behavior, and then others are very clear that this kind of behavior is abnormal. So if one behaves in a manner that does not conform with the statistical requirement, then it is said to be an abnormal behavior. So what is abnormality, or what can we say abnormal behavior is? Hello? Hello?
Yes, ma'am. We are with you, ma'am. We are with you, ma'am.
Yes. So what is abnormality, or what is abnormal behavior?
Abnormal behavior or abnormality is something that is abnormal. It's not in accordance with the usual norm.
Good. It is
It's
not in
a
line with the
proper way
norm.
of it. Yes,
It
ma'am.
is far away from the norm.
Yes, ma'am.
So, and that is why a part of the knowledge says that psychopathology is viewed as deviation from statistical psychological normality. Deviation from normality. It's said to be deviation from statistical normality, or from psychological, from what is termed as normal. So our understanding, with what we have discussed so far, I believe that we have an understanding of what psychopathology is and what it is meant by someone not being normal or not behaving in a manner that is normal, or in an appropriate manner that is classified as someone who is classified as having a good mental health. So we did mention something about
Yes,
paranoid delusions, hearing of voices. When you start hearing voices, and when you're having some delusions, it then means that you're having some mental issues that you need the care of a medical personnel, a psychiatrist, or you meet a clinical psychologist, or you just run down to the hospital and then you try to find out what is really going on. So like we were talking about earlier, we're talking about things like shyness, stressful day at work, and all of those then grieving for one's death. Those are not particularly disorders, because they do not take a stipulated time as ascribed by the DSM-5. So others look at what other
confusion, ma'am.
what?
I have a little confusion.
Yes, can you say it?
Okay, if a man pays a girl school fees,
Hello? I'm listening.
and at the end of it, or after graduation, the girl decided that she will marry a town man rather than that person that paid her school fees, and the person develops abnormality. How can you describe that situation?
Okay, when someone pays a lady's school fees, and then afterwards the lady refuses.
You got my question.
Can you stop making noise there? Okay, I'm listening to you. Yes. Hello. Hello.
Yes, ma. The question he posed is.
Okay, I'm trying to understand your question.
If a man
listen to me? Listen to me. Listen to me. Are you listening now?
Yes, ma'am.
Okay,
yes,
you are trying to say if someone pays a lady's school fees and then after graduation the lady dumps the man for another. Is that what you're saying?
Yes, ma. That's
and
the question.
So what happens? What happens?
He said, and the man began to behave abnormally. Now, how can you describe that? Yeah.
Oh,
that's his question.
Okay. That's fine. I remember I had said that when a behavior takes a particular duration as stipulated by the DSM, if in the DSM it is stated that this particular behavior must be exhibited in like 2 weeks or so duration, then we can say that the behavior is abnormal. We can say that the behavior is a disorder. But then when a behavior does not maybe that has not occurred for stipulated time as reflected in the DSM-5, then we don't have any right to say it is a disorder. So if someone has paid a lady's school fees, and then maybe at a point the lady turned him off, and she has gone to marry another, and then this person, as a result of that, has developed depression, and then the situation shows that the person has been in that situation for some number of time as stated in the DSM, then it is a disorder. But then if he develops stress and some other issues just within a period of time that is not stipulated in the DSM-5, then it is not a disorder. I think what you should understand here, basically, it's you should know that for you to classify a behavior, or for you to say a behavior is a disorder, you must make reference to the DSM. It helps and it guides you in trying to understand that that particular behavior, whether it is a disorder, whether you should say it is a disorder or not. I don't know if I'm talking about your question.
Yeah, your point, Fuma.
Okay, are you clear?
Yeah, we are.
Okay. So the point you should understand is, first of all, we said psychopathology is a systemic. It follows a systematic process. It tries to identify the causes. It talks about the symptoms. It talks about prognosis. It talks about diagnosis. It talks about prevention. It talks about treatment. These are systematic approaches which are considered in order to put a mentally ill patient in order. So now, the DSM is also like a dictionary for the clinical psychologist. Now, the DSM helps you to be able to associate what behavior to what behavior. And as stipulated in the DSM, you are able to say, yes, this behavior has taken long for so time or period of time. And so the DSM says if it is up to 2 weeks, then there are other symptoms that follow that you have seen in DSM that the person has been manifesting, then you can now say that is a disorder. Otherwise, no. Are you clear?
Hello, ma.
Yes.
Yes, we're clear, but I want to point out something, ma.
Okay.
We are talking about infrequent, and in the example here, you talk about paranoid, delusion,
Yep.
and hearing voices.
Yes.
Now, a situation whereby is it possible that somebody who has lost a loved one, and as a result of the depression, that can even cause someone's mental health? Is that possible?
Then, if the loss of someone can lead to someone having that situation,
Is that possible?
No, I will not give you a yes or no answer. I need to explain to you. Now, it is if someone who lost someone, and ordinarily, we know that when you lost someone, and every one of us have lost someone, isn't it? But you have not remained in that state. You are able to come out of that state, you will be able to cope, isn't it? So if someone is not able to cope with that situation and leads to another, then there was another factor before the loss. So if there was another factor before the loss, then the person needs to be given attention, medical attention, as to be able to identify what was the problem or what led to the other. And that is where this explanation, historical explanations come in, and that is where biological explanations come in and psychological explanations would come. Do you understand?
Yes, ma'am.
Okay, can we move on?
Yes, we can move on.
Okay. So now we have psychopathology as maladaptive or dysfunctional. Now, when we were talking about psychopathology, we also made mention of maladaptive behavior. The study of the scientific study of maladaptive behavior and how to handle this the situations. So when someone puts forth or when someone puts forth a behavior that is not another that causes dysfunction, or puts out a behavior that reduces functioning, like we're giving examples of people who are in their workplaces and are not able to work and all of those. And I did mention that when someone has mental illness, it is to say that the person is not able to function, because we need our cognition intact, we need our mental health intact to be able to function. Hello? Hello?
Hi, ma, we're all here.
We're here.
Okay, but I'm hearing someone talking. Can we?
Where with you, ma'am? Where with you, ma'am?
Yeah, at the moment, can you mute your speakers?
The person is just unmuted unknowingly.
What?
No, the person unmuted unknowingly.
Before you know, she shot me mana enter.
Can you mute your speakers?
Times. But if this thing is this.
Topa teso.
Okay, move on, ma.
Okay. It's okay. So we're talking about different views. And then in a case where a behavior it's maladaptive, it means that the behavior is abnormal. And then if the behavior is not maladaptive, it is a normal behavior. So others look at psychopathology as the study of maladaptive behavior. Others look at psychopathology as a study that deals with statistical deviation from the norm. When people deviate, it is to say that the people, those who deviate, have issues with their mental health. So we also have psychopathology as distress and disability. Now, in every situation of maladaptive behavior, people are distressed. People have disability as well because they are not able to function. And because they are not able to function, it is automatically a disability. And so, but then distress distress is subjective in the sense that what happens to one may not happen to the other. Why I say it is subjective, it is, and now you can say that when let's use that instance of the loss of someone, or maybe let's just use that the loss of someone. Now to many people,
or maybe
hello,
frustration.
Oh, okay.
Frustration
Anyway,
one could be
a situation. I'm looking for a situation. Are you listening to me? I'm looking for a situation that will present itself before the person will be frustrated. So, I don't want. Okay, can you give me an instance where someone's maybe experience can lead to depression,
joblessness,
also to frustration,
joblessness.
Yes. Now, when someone is jobless, to the other, he becomes depressed. To the other, it is nothing. You know, the other may have hope.
Excuse me, ma. Excuse me, ma.
No. Hold on. When we are talking, you allow me to talk. If you want to ask a question, when I'm done, you can ask questions. Your questions are becoming too many. And with the way you are going, we cannot finish this today. So I want us to finish this today. Tomorrow, we still have another. And like that, up till Friday, we need to finish everything about psychopathology this week. So please don't delay me. Just pay attention. When I talk to the finish and you don't understand, just show by a raise of hand, and I will give you the permission. Is that okay? Let's behave ourselves. We are not children. Is that okay?
Yes, ma'am.
Yes, ma'am.
Okay. So we were given an example. We're talking about frustration when someone doesn't have a job. And then for others, it will lead to depression. For others, it may not lead to depression because we have different individuals and our abilities are different. And the way we function is quite different from the other. So, as we're talking, I want to tell you that, and that is why I said distress is subjective, because it depends on the individual as well. So now, why do people seek mental health treatment? They seek mental health treatment because they are having some dysfunctions. They are not able to function well. They are not able to think well. They are disoriented. They are not coordinated, either in speech or in thoughts. And so that calls for mental attention. Now we also have psychopathology as social deviance. Now, when someone deviates from social norms or cultural norms, it is said to be psychopathology. It is said to be social deviance. Now, in some cultures, there are some issues that individuals at times fail to meet up to, and so they fail to meet up, and so when they fail to meet up, it is like deviating from the normal status of the culture. So, yeah. So in terms, like, let me give you an example. Like, in some cultures, sleeping with another man's wife, it's a taboo. Like in the Tiv culture, sleeping with another man's wife is a taboo. A man can pick up a machete and pieces you into a lot of smaller pieces. And so the social aspect as well, in a way, in a manner where people are to behave in a particular way, like we are in a school environment. You know that the school environment, this is what should be done, this is what should not be done in the school environment. And then maybe you come to fight in the school environment, that is a social deviance entirely.
Already
So we also talk about psychopathology as not being able to control yourself or to regulate yourself, your feelings, your mood, and all of those. Now you're thinking, now how do you feel? How do you maybe think about certain issues? Now, when you are not able to control yourself, to think properly, to feel in a better way that you should, take for instance, a little thing said to you will make you feel so bad, will make you be like you want to pull heavens down, and all of those. These are maladaptive patterns of behavior. When you don't think rightly, when your cognitive bank is not in order, you are having too many of negative thoughts instead of positive thoughts that will lead you to progress. You conceive a lot of negative thoughts, and you are there always saying that this person does not love me, this person hates me, this person, and all of those. So these put together will help you not to have that self-control. And again, let me give an instance of maybe in a wedding feast, at the reception ground, when you see beautiful women, you see people dressed well, and all of those. I'm just bringing these examples, this little examples, so that you can have a better light of what I'm talking about. Now, in those instances where food is being taken around, you discover someone who has been well dressed, maybe made a speech as well, will start misbehaving and start going about looking for food. Some can even get up from their seats and ask the person sharing food that you have not given to me. Can't you see? You don't have eyes, and you know those throwing of negative words, and maybe some saying, for me, when I'm in the gathering like that, it is always like that. People don't recognize me. They give me the bone and all of those. But if we realize that we have to control ourselves, then we have to keep mute and allow whoever that is sharing the food to bring the food and give us whatever that is being given to us. It's not our home, so we should be contented with what we have at that moment. So such things, and then feeling bad, having negative feelings and feeling bad all the time, feeling sad all the time, it's not a good thing. We need to control ourselves in spite of difficulties, in spite of a lot of disturbances in our lives. We shouldn't allow things to go wrong with us entirely. That means we can cope. That means we can cope. And if we have the self-regulation, then the better for us. If we have self-regulation, we can do better, and our well-being will be improved. So that is that. Then psychopathology as harmful dysfunction. So harmful dysfunction is presumably grounded in evolutionary psychology. And it acknowledges that the conception of mental disorder is influenced strongly by social and cultural values. So harmful dysfunction could be things like, maybe, let me use this. You're taking Igbo. You're taking Igbo, and you know, some know that marijuana would lead them to a lot of issues, and yet they consume it, and it destroys them. It destroys them and leads them to a lot of confusion, and mental illnesses and all of those. So, and then that can also make them be agitated and also cause harm to others, to themselves and the society as well. So psychopathology is also recognized as harmful dysfunction. So what are the tasks that a psychopathologist carry out? What does the psychopathologist do in trying to meet up with standards and trying to understand and trying to handle their patients and all of those? So here we have under descriptive psychopathology, we have ability to record and describe the changes in behavior of such a patient. You know, when patients are on admission, what happens is you clock them. As clinical psychologists, you clock them from time to time, and then you try to know how they are progressing, whether the drugs that are being given are adequate, whether they are responding, or whether they have relapse as a result of not taking the drugs, as a result of not taking it in right proportion, or as a result of not taking that particular drug they are supposed to take. How are they progressing and all of those? And can they be discharged soon? And can their behavior be changed or what? And then those are the things that psychopathology looks at. It helps, it goes about record. As it studies the mental disorders, it doesn't just study it like that, but it records and describes the changes in behavior as they progress. So another function is to explain. To explain. When you have recorded, you have described, you explain in detail how that behavior came about, how the behavioral abnormalities came about, what caused them, and what are the symptoms and what stage is the mental illness. Is it a severe case, or is it just a case that can be dealt with as soon as possible? Is it going to take long? Because some mental health patients, you see them are on bed and they stay a long time. Some stay for a year, some stay a few months, some stay for just 1 month, depending on the severity. So the doctor or whoever, the professional, the psychopathologist explains how all those things, it studies all the causes and explains whether there are underlying developmental issues as well. Maybe when you were a child, what happened? You couldn't work on time and all of those. Could it be as a result of some brain issues, some developmental problems and all of those? You know, some children can stay for up to 2-3 years before they work, some even up to 5 years. And they are at times given medical attention before they can regain themselves. And so many of these things like that. So to understand is another task. When you try to understand the issues surrounding mental illness, the better for you. You'll be able to interpret better. You'll be able to diagnose as well. Now, for instance, when you look at when you try to study the DSM-5 more in depth, and then you try to understand that particular disorder that a patient is suffering from, you get to know, have a better knowledge about it. You will be in a better position to handle that person, and you will be in a better position to help that person improve their quality of life, their well-being, and their functioning. And if they are handled properly, they can get back on their feet and be able to go back to their offices or go back to their places of work and function adequately and perfectly. So here we have theories of psychopathology. We have theories of psychopathology, and earlier we talked about explanations, historical context of psychopathology, and now we are looking at theories of psychopathology. They may be seeming the same. They may be seeming to give you the same understanding of how those mental disorders have been explained in earlier slides. We have a biological perspective, and in the explanation, I did mention of genetics and chemical imbalances. Now you try to understand this theories of psychopathology. We have biological theories, we have psychological theories, we have I say psychology, sociocultural perspective. So this, a theory helps in explaining something. A theory helps in explaining an idea. So when you have this perspective, they help you to understand, to give you a clue on what you don't know or what you know but maybe be lacking in some aspect. Are you listening? Are we together?
Yes, ma'am.
Okay, that's okay. So we have the biological perspective, and here it is. It focuses on genetic factors and neurochemical imbalances, such as dysregulation of serotonin and dopamine neurotransmitters, which contributes to mood disorders and psychosis. Earlier, we talked about imbalances in the chemical transmission in our brain, and then when those imbalances are there, we experience mood disorders. You can also experience depression as a result of the chemical imbalance. You also experience anxiety. You can also experience schizophrenia. So it is to say that trying to keep this in check, trying to put this in order, trying to look at the book I talked about, the dictionary of the clinical psychologist, will help us to handle the situation much, much better and help these patients who are undergoing these issues come back to their senses and be able to be on their feet and function better. The whole essence of treatment or of understanding this in order to help these people feel better is to help them function again, function well again, to improve their well-being. So another theory, see, under the biological perspective, we have the hereditary perspective, which is still on the biological perspective. Here, we can talk about issues of heredity, like when you are sick, or when a schizophrenic patient is disturbed and is taken to the hospital, usually the caregivers have been asked some questions to try to know or to understand if this is in the family. So if it is in the family, then it is a genetic issue. But if it is not in the family, then it is not a genetic issue. But they can look at other biological issue. If it is not hereditary, it may be as a result of chemical imbalances, either by, will I say, accidents or whatever damage to the brain can cause a lot. We have psychological perspectives. Here we talked about psychodynamic theories. We have a theory called Freudian theory. It is a psychoanalytic theory that talks about unconscious conflict from childhood to adulthood. And there are some other theories that also have talked about those conflicts as coming from the environment. So you see that we have these different perspectives to help us understand that mental illness do not only come from supernatural perception or biological perception, but also from psychological perspective. So these have their unique way of expressing various ideas and helping us to understand and then be able to improve well-being. The whole essence, it is to improve well-being. When well-being is improved, functioning is improved. When you are in the right frame of mind, you are able to work better. When you are stressed, just stress from work, you are not able to work well and you can commit a lot of errors. So that is that. So any question?
Yes, ma.
Yes. You can ask your questions now.
Question.
Yes.
Because
you can ask
I was thrown out by the network. So according to you, how many theories do we say that link to the psychopathology? Because I joined you at last explaining. So you can say there are how many theories that explain psychopathology?
Okay. There are so many theories, but I'm going to throw it back to you. You are a student and an MSc student. You should be navigating your Google. So I'm going to give it back to you as an assignment. When you go back, you are going to go and Google theories of psychopathology. We have mentioned some here. We have mentioned some theoretical perspectives here. But then when you go, check for theories of psychopathology. You are going to find a number of them, even with these ones we have mentioned here. Have you got me?
Yes. Is this your own that you have given that you can throw more light and even mention them? Because it's like I lost the logic. So if you can explain to me, I will align myself with your logic. Thank you.
Okay, it's okay. So we were talking about several perspectives. We talked about biological perspectives. We talked about social cultural perspectives, and we talked about psychological perspectives. Under biological perspectives, we have a genetic aspect of it. We also have hereditary aspect of it. And in the genetics, we talked about the brain, the issue of the neurotransmitters, the chemical imbalances, and all of those. And there I said that when there is an imbalance in the neurotransmitters, take for instance the dopamine and serotonin, what happens? Your mood will change, and that leads to at times depression and psychosis. Now it can also be like an imbalance in the dopamine, the neurotransmitter called dopamine, can result to schizophrenia. So you can use that biological aspect to explain, but that does not give a total explanation of that. So since we have other perspectives, you can also look at other perspectives. Though you have got this explanation here, but then you will look at other perspectives. What are they saying about this kind of situation? You're looking at all this in order to help the patient grow. You help the patient. Hello?
It's something within the department.
What?
Important.
Hello?
Okay.
Hello? Hello?
I think
To
Yeah,
pass
with you,
this
ma.
is the person
With you.
still distracting the class.
Okay, so you also look at, after you look at the biological factors, which encompasses genetics and heredity. And then you can also look at the sociocultural perspective to give you an understanding. You're looking for understanding to understand the interpretation of mental disorders, how they manifest. You're looking at how they manifest. Are they coming as a result of taking a lot of alcohol, taking a lot of illegal drugs? Are they coming as a result of that? Or are they coming as a result of marijuana that someone has taken for a long time? Then are they coming as a result of conflict in childhood? Is someone being depressed because the person had conflict during his childhood days or what? Then is someone having a schizophrenia as a result of biological issues? So when one goes to the hospital with a mental disturbance, the professionals would ask series of questions and try to understand using these perspectives. Do you understand me now? Hello?
Yes, yes, we do. Yes, understand, ma.
Okay. Any other question? Yeah. So in the absence of any other question, can I give you an assignment?
Yes.
Can I give you an assignment?
Yes, ma.
Okay. Now, discuss in details or in detail one theoretical perspective of psychopathology. Have you heard?
Ma, you come again for the sake of those of us looking for Byron.
Okay, discuss in detail. Discuss in detail. Okay, discuss
in details.
Discuss in detail any theoretical perspective of psychopathology. Discuss in details any theoretical perspectives of psychopathology.
Any theoretical perspective.
I'm telling you. Okay, let me explain what I'm saying. I'm saying you are going to do an assignment. And this assignment is going to be about theoretical perspectives of psychopathology. So I'm asking you to discuss, every one of you discuss just one. One theoretical perspective. Anyone at all. You can, any one of your choice. Just pick one.
Even the one you mentioned.
Yes, even the one I mentioned.
Anyone now.
Anyone. But not all of you should go to a particular perspective. There are many perspectives. So what you will do again is you're going to Google. You are going to Google and read more. You are going to Google and read more about the perspectives. Do you understand what I'm saying?
Yes, ma.
Yeah.
Yes, ma.
Read more about the perspectives. Then you are going to just discuss one perspective of psychopathology.
Ma, how are we going to submit it?
You are going to submit using my email address. I'm going to send to you.
Okay, ma.
Yeah.
Submission date is when?
Submission date.
After the lecture now.
Yeah. Submission week after the lecture. Is that okay?
Sorry, ma. That is after this week.
Yeah, you know, even when we are done with the lecture, you can still make submissions to my email, to my inbox. Is that okay?
Ma.
So
All right.
I will allow you to read about it and do it very well. So are you listening to me?
Yes, we are listening, ma'am.
Making this a market.
Yes,
You're
yes,
making
we are
this
What's wrong
listening.
now?
This is a market.
My, your email, please.
Okay, I'm coming.
Yeah.
I'm coming.
That means the submission date is on Friday.
They say even next
Next week,
even
Monday. Next week,
People
Monday.
making noise.
We're going to
Allow us.
submit
Next
it next week.
week Monday.
Monday should be the
Okay,
best date, man.
next week Monday.
Monday, man. Next week, Monday.
Jigba, you are not a lecturer. Allow the lecturer to give us the
No,
Jigba.
Course
You're not a
rep.
lecturer.
I was only suggesting. I was sorry. Me and myself.
Jigba, there was no room for
very too
suggestion.
small.
Jigba, there
Okay.
was no room for
Okay, are you
suggestion.
listening to me now?
Yes, my,
Yes,
your
ma'am.
email.
To me. Or since you are talking little children, can you suggest a date for submission? Since you are
Ma,
talking like little children,
after the lecture, we'll submit the assignments.
how many people are saying? How many people are saying
by Monday.
we should submit on
Next
Friday?
week Monday.
How many people are saying we should submit on Friday?
No, sorry, ma. For some of us, after the lecture week, which ends on Friday, then by next week Monday we'll submit.
We'll submit
The submission date should be between Monday, Tuesday, Wednesday, ma.
After the lecture.
A lot of noise. You can make a lot of noise.
Class, can I suggest something?
Don't worry, I'm trying to send you my email, my Gmail.
Okay, class, you know that Monday is another lecture on another course, new course. So why not Friday as the lecture and new course, then we submit the assessment.
So can you
If you
see
can
my
submit,
can you see my
if you
my
can
email
submit
address?
on Friday, you submit. If you cannot submit, you submit on Monday.
Can you see my email
If it's
address?
Saturday,
We have not seen it.
Who wants to speak?
We have
No,
not seen
not
it.
yet, ma.
Seen it.
I've not seen it.
Sakura, Desmond, Defa.
Okay,
You
we
want to
can see
speak?
it, ma.
You want to speak?
We have seen your email,
Your
ma.
hand up. Your hand is up. Okay.
Yes.
All right.
The suggestion is that your lecture is ending on Friday.
Yes.
So in between that Friday or Saturday, can we submit? Because Monday is another course, new course beginning on that Monday.
Okay. So you are saying that Friday will be ideal, huh?
Friday
Yes,
or
ma'am.
Saturday. Saturday should be the deadline.
Now, do you know what we would do?
Ma.
He's speaking for himself.
Listen to me.
He's speaking for himself.
Listen to me. Stop talking. Are you listening? Are you listening to me?
Yes, ma.
Yes, ma.
Okay.
Yes, ma.
What you will do is that anyone who finishes today should submit. Anyone who finishes tomorrow like that. So your submission, the last date for your submission is Saturday.
Okay,
Are
ma.
you here? Last date for the submission is Saturday this week.
Okay, ma.
Date for the submission is Saturday this week. Take
Thank
note
you,
of
ma.
that. Yeah.
Ma,
Submission date.
I have not seen the email.
I have
It's on
sent
the
Go to
platform.
chat.
It's
Go
on
to
the
chat. Go to chat.
platform. Go to
Ma,
chat.
Okay.
I will send the email to the group. I have copied the email. I will send to the group. My student.
Some of you, the kind of noise you make in this class is too much.
Class rep. Class rep. Class
Class
rep.
rep is
for
class
us.
rep is on errand.
Who is a class rep?
It's fine, yeah, but it's not in class. It's on errand.
Who is assisting him?
That's
So now I am the one.
Who is there? I'm the one.
Desmond.
Desmond
You are the one.
is there.
Yes,
Okay,
ma'am.
Desmond. Can you help me do something?
Yes, ma'am.
Okay, what you would do is this. Snap the participants for me. Are you able to snap?
Yes, ma'am.
You're able to snap the participants.
Yes, let me start from the beginning. And I have snapped. Let me go down again.
Did you take a picture of me while I was lecturing? You took a picture of me while I was lecturing?
No, ma.
Okay, just snap the participants, and then tomorrow, remember to take the picture of me as a lecture. Is that okay?
All right, man.
So you can snap me as we are appearing there at the other side.
Okay, I'm capturing each one now.
Okay, have you captured everyone? So when you capture, send to me.
All right, man.
We have 43 participants, eh?
Yes, ma'am.
Yes,
Others
ma'am.
left. How many people left?
Well, I see 43.
43, okay. I can see it. I can see Abu Sesu, Simeon.
What?
I can see Silas.
Yes, present, ma. Present, ma.
Rafa, Abu Emmanuel.
TV Raf, man. Thank you, man.
Abu Andakura. I can see wait, let's see. Ajaka Godwin Sunday. I can see Ageda Xavier. Atse Tokuma Beatrice. Shamke. Calvin Azenda. Bambuan Anastasia. Busu Kumaden. Waika Gemga.
Present, ma.
Yeah, John Ode, Igbamimi Do, Lucy, Jennifer. We have
2 Jennifers.
Iwodi Lucy. We have Jennifer. We have the 2 Jennifers. Jatu.
Yes,
we have Miriam. We have Silas. I've called that name before. Why is it? Do we have 2 Silas here? We have a
really.
Sogo.
It's only one Silas.
We have a Zoma. We have Nyangi. Ogaba Isaac. We have Precious Omodu. We have Precious Ifan. We have Queen Nafisat Mohammed. We have Rosemary Idu. Samuel Omonya. Sylvester M. Tongu. We have Samuel Hifan. We have Topav Teso. We have Viren. Victor Uma Blessing Viren. Uti Kenneth. We have Victor. We have Unisa. We have Zasha Nelson Ute. And that's all, I think.
I didn't hear my name.
You have not called my name, Jigba Augustine. Jigba Augustine, number 1. You have not called.
Jigba, you are not in class. Jigba, you are not
How
in
can
class.
Jigba be number 1?
It's too much.
You say you're number 1. Where are you?
Jigba is
not
number
just Jigba. I didn't hear my name.
Are you listening now?
Disturbing. Jigba, you are disturbing.
Yes, ma'am.
You are disturbing, Jigba. That's why I did not hear your name.
Are you listening?
Let's pay attention, please.
Are you listening?
Yes, ma'am.
You see, you are beginning to behave. Yeah, you are beginning to behave abnormally now.
This an aspect of psychopathology.
So when we're in a class, you're not supposed to make a lot of noise. If someone wants to talk in a forum like this, you will just raise up your hand and you'll be given permission. So, and then tomorrow, as we come, please put off your loudspeakers, your speakers, switch them off so that we can have a good class. The class today has been so noisy. I wouldn't want this to repeat itself again. Assume yourself that you are in a normal class. Is that okay? Though you are in the comfort of your homes, yes, but then Assume yourselves you are in a normal class and stop those side greetings and all of those. Stop making noise and let's do something. You are not little children, are you? Some of you
No,
are,
no,
some of you are grandparents. So please, let's be. Is that okay? So, and I greet every one of you here who has attended my class. And I pray for you that as you go home, you'll be strong to come tomorrow so we can go on with the lecture. And as you come like a different person, a normal person.
Amen, ma.
We are praying for. Is that okay?
Thank you, ma.
Yes,
Thank you, ma.
Thank you. Thank you, ma.
And
wonderful evening.
And you too. Thank you.
Thank you. And you. Pleasure.
Nice day, man.
Nice day.
Say you come like normal people.
Remain blessed, ma.
Same to you, man. If not like schizophrenia. If not like schizophrenia.
They always talking jigba.
Please, can the admin end the class, please?
The autonomous jigba. You know, it's only jigba that has autonomy in this class. So.
Admin, please end the class. The class is still recording, please.
Host now is not amongst us, so it's SS Masters Zoom. So they are the ones who end the meeting. Or we can leave individually.
Come on there now. No.